Okay. Hello, Dr. Joe, and today I will be doing lips for you. We're going to be doing lips for Natalia. She wants to volumize the lips and obtain a bit more shape as well. That's what we'll do. Okay. Do a 25 gauge today for her. Should we cleanse? I like to cleanse a lot, don't I? So clean, 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 clean. Yeah, but they're definitely gonna restore the shape and fill in the little gaps. That's why I was giving you that kind of like, we're gonna be aiming for a Russian style lip. And that's what she's asked us for. So what is the Russian lip technique? You can see it there. Okay. Now, it's because it's like interactive, so you can see. Augmentation. My gloves are clean with anisette or clinicette, whichever. And use a little needle for the entry point. Okay, you ready? Let's start over on this end. You can see there's asymmetry here. You okay? That hurts a bit, huh?
Sensitive skin there.
Yes, it's a very sensitive area, really. So you're using a bit of Vactrim, which is got lidocaine and antibacterial, as long as I already have the Clinicept. So I'll go like this. I'm first going to open your eyes a little bit. Okay, my target's going to be here, to here, here to here, here to here, here. And you're going to do a close to the meridian borderline. Here we go. We're in a little hole. Entry point, ready? You okay? You can see. There's the camera. strand. Go back. Same thing. And then go back. Okay. And then go back. Do one closer to the million border and drag it down. Okay. What we're doing is volumizing little by little, very small amounts. I've only done 0.1. And that's going to be volumizing it exactly where it needs a bit of volume. We can press on it and turn it a little bit. The letter is very cohesive, so it follows, it stays together really well. You kind of spread it, but it'll stay together all in itself. It's a very cool product. It looks nice already. A little bit more volume. Was that painful? Not too bad. Okay, you're all right. Gentle pressure and turning upwards. Now I need just close to the vermilion for the shape, but we'll go ahead and do that right there. We'll do some strands to produce a bit of a lift and turning of the lip from more in that Russian style, and that shape as well here with the little retrograde injections with the needle, of course. So, Already. 27 gauge needle. Now 27 gauge needle will be because I want it to be releasing the product a bit more in a bit more quantity with less pressure, so it doesn't like shoot out like a squirty gun or like a jet washer. I want it to come out slowly and gently in the tissue, so it produces less damage. Okay. I'm going to prime it actually because I'm not going to ask. From here to here, here to here, here to here. Ready, sharp scratch. You okay? Mm-hmm. And now just gently massage that in. That was a fanning technique, really superficial. Level 2. Closer to the superficial dermis or reticular tissue. Just below it. Look at that. It's nicely evened out. That hurting? That hurt a bit more, right? Or not too bad? No. There we go. It's nice and even now already on that side. Move on to the other side. Bit of pressure. And then move on to the other side. Put the cannula again. You're okay? You need to sneeze?
No, just allergy
Oh no.
from Houston.
Yeah. It's got a bit of back trim and a bit of anisept or clinisept. Look at that volume already on that side. It's gorgeous. Okay, so here we go again. You ready for a little sharp scratch from hell? I mean, a tiny little scratch. Sorry. Hold it for a sec to make sure it's not dripping out any blood. Going on another vessel. And we know that the facial artery from the oral commissure is going to be about how far? Yeah, about 13 millimeters. Oh, better put it down. Okay. Candidate. And target here. Ready? This is a slightly deeper injection than the one before, but you can still see we're really superficial. So we're not any more than, we're about 2 millimeters depth, if that. You okay? You can see. We're still on the wet dry, above the wet dry border. I'm just painting or brushing, as it is also known. Hurt? Did it hurt? Not too bad?
Slightly.
A little sting? You can see that's already more even. And again. So between that other side, between the left side, patient's left side, I had done the initial one at 0.1, and then I did another 0.3. So 1, 2, 3, 4. Yeah. So on this side so far, well, no, I did another 0.2 and then a 0.1. So on the left, we've got 0.3 so far and a 0.1 so far on the right. And I'm gonna, you see, I'm gonna add some more now with the needle. Again, a little 27. Again, if I'm not going to aspirate, then I don't prime it. If I'm going to aspirate, then I'll prime it. You okay? On the top. Sorry, you okay? sorry. That hurt. I could tell. It was painful. I think that one didn't seem as sharp, the needle, for some reason. Now we're working on vertical height. That's what we've done with these last 2 points. It's the vertical height. And a bit of the shape as well. It marks out a bit more of the vermilion border, or the cupid's bow really. What we're going to do next, we're going to place some product just underneath that white roll or vermilion border, really close to it, and we're going to do little tiny threads so that it folds it up even more and gives it more definition, but not so much in the actual vermilion border. Move the pressure and turning. And you can see it still needs a little bit more here to get even with the other side. Go back to the cannula, a little more strands. And that'll be it for that one. If you saw that, that's actually a better way to get the needle off of the syringe. Oh, this is it. With the cannula. You okay?
Mm-hmm.
Check and superficial. There's the tip. Looking good. It's just for natural anatomy. She has these dips in here. So we're just going to try and fan them out a little bit more with the 31 gauge needle to make them nice and smooth. It looks a lot better. It's gaining that shape again, volume. I think you'll like it a lot. Good, you're doing good. So just nice little strand here, cupid's bow. Maybe a little bit of a philtrum column. It's a little bit flat. Not too flat, but they are a little bit. That's the needle. Now I'm going to place a little line underneath the vermilion border for definition. Very small amount, so in total I'm doing about 0.02 in this little strip that we're going to do here, from here to here. Pinch. Very, very, very superficial, just below the vermilion border. smell that. Tiny little pinch, and then you can see that product placed there. Does that hurt? A little bit nippy. That's great. And then do the same for this one. You okay? You ready? Again from here to here. Just a little pinch. And superficial. You can see that little line. Just shaping, defining. Look at that. Beautiful. And we can do the same in the Cupid's bow to make it even more pointy. So we'll go again. I'll change the needle so that it doesn't get dull. Okay. So you're doing all right. And this is going to be down towards the Cupid's bow. Double up right here from the corner. The GK, right? And then it'll drop more right at the end before it come out. It gives you this That's terrible. They hurt these ones. Really superficial. Really taking shape. You might just need a little bit of a deeper injection to that point to project onto. Sometimes the massage does it. Move that product a little bit. There's the lateral balance. You have to remember. You can't do this with every product. That was really good. It stays together. Okay, now we just have to match the bottom. If you do more vertical lines, you do these. Just some tenting. You can roll it even more, but I think that would be too much for her. So we have 0.3 left. We're just going to go in the bottom. We're going to do a 3-point technique really for the bottom lip. Volumize it like this. 1, 2, 3 pinch. A little bit deeper. You okay? Does it hurt?
Not really sensitive.
You have little tiny dots on your lips. Have you always had them?
I don't know. Maybe.
Like little tiny red dots.
I don't know what it is. Maybe.
You've noticed them or never?
I know. Maybe like like one of the video I injected me for that bruise. What it could be from?
Don't know. I think something you always had all your life. It looks like freckles.
Really?
Like tiny little freckles on your lip. Or little hemangiomas, they are in medical terms, the little tiny red dots. Okay. How long is that pull for? Okay, now I should have stopped a little bit before. Okay.